It is 8:38 on March 29th. Women from all walks of life gathered in Newark for one-of-a-kind event. Let's talk women's health and wellness. It was a day packed with education, empowerment, and candid conversations about the issues that matter most to women's well-being. The event was inspired by two-time breast cancer survivor Deb Belfatto, who joins us now. Deb, good morning to you. I know this event is deeply personal for you. You survived breast cancer twice. Can you tell us what sparked the idea for Let's Talk Women's Health and Wellness and why it's so close to your heart?
Oh, thank you so much, Kent, for this wonderful opportunity. And what sparked it was the second time around, as I endearingly referred to that diagnosis as my WTF number two. I
Mm.
was recovering. My daughter and my husband were trying to get me to sit still. Don't do that very well. And I'm like, I've got it. I've got it. I want to build a symposium because we were at the peak of the pandemic and women couldn't access healthcare, let alone life. Life was just, who knew what life was? So I looked at my husband, and he's used to my, oh, shall we say, outlandish ideas. And I said, yeah, want to build a symposium. It's more needed now than ever. And so he thought, and he said this to me the other day. He goes, "Oh, a couple hundred people." I'm like, nope. Want to host this at the New Jersey Performing Arts Center. We want to think now, as my sweater says, we want to think bigger, better, bolder. The more women we can reach with life saving information and empower them and equip them with the tools to be their own best advocate, the better. So that's when it all began. It was just the other day, April 15th, was the
Mhm.
anniversary of my bilateral mastectomy. So hooray for me, and because I have access to quality health care.
And the benefit through this is, thank God you're alive and you're here and you can talk about it today. I know it's a life-altering, tragic event at the time, but I thank God that you're sitting here and you're healthy, as I knock wood, and you can talk to other women and all of us about your experience and what it's like to go through it, and that there's light at the end of the tunnel. You can come through on the other end. What do you think the attendees got from this big event this year?
Ay, ay, ay. So much. The content was so rich. This was year three. And oh my goodness, the advisory board, along with myself, just put together a program that was so on point. The topics, we talked about menopause, we talked about mental wellness. Everything is driven from our five pillars of wellness, and we covered it so thoroughly in such a comfortable, caring, loving space. I mean, NJ Pack just welcomes everyone and anyone. And
Mm.
when you looked that day around the space, I don't know, for me, it's like this is what the world should look like and can look like. It was
Right.
pure and true sisterhood. Women came from everywhere and anywhere to reap the benefits of this day.
Deb, if I may
We
jump in,
registered,
we just had
yeah.
Deb, we had on, I know you probably know her and can appreciate this. We had on Tamsin Fidel the other day, who is the
Oh, you did?
menopause expert, right? Tamsin is awesome, a longtime friend of mine. And one of the things she talked about, I know you could probably talk on this, is the fact that women spend so much of their lives caretaking for others. They take care of their husbands or their partners, they take care of their children, their grandchildren, and they never take time for themselves because they're exhausted by the time they help everyone else. And did you find at this gathering, did you find that women tend to ignore themselves and put themselves last on the priority list, and that they need to up priority for themselves.
Well, absolutely, positively. Um, we open that day with letting women know how worthy they are of being there. And I like to refer to this day as their me day. And it shouldn't be just be one day. There should be times, frequent times, so that we can refuel and re-energize and renew, because we're everywhere doing everything. So I have been in Tamsin's company a lot lately,
Mhm.
and we're talking the same talk and we're walking the same walk.
Yeah, she's awesome and you're awesome. And I know that net proceeds from the event go to local nonprofits supporting women's health. Why was it so important for you to give back in that way? And how will that support make a difference?
You know, we're working towards that. To produce an event like this is, it's costly, and we have to raise a lot of money, and we have partners in the community, and we're building more partnerships because we really want to expand upon Let's Talk Women's Health and Wellness. It's not intended to be a one and done day. We have to get our voices out there. We're working on a podcast series. We're working towards fueling the future of Let's Talk. We're planning local community events to give ourselves even more visibility. We're working with community agencies. We're working with many places of worship. So we're covering the bases because we want to reach all women, because all women are deserving and worthy of access to quality health care. I survived my breast cancer in 1988, and I survived my breast cancer diagnosis in 2021 because I had extraordinary access to health care. So we're going to keep this going. We're not stopping ever, as far as I'm concerned.
Amen. Amen. Keep it going.
Amen.
Deb Belfatto. By the way, for those who don't know, Belfatto means made well. That's what, or it can mean made well or done well in Italian. I'd say you qualify for both. Best
Well,
of health
thank
to you.
you.
Happy Easter. God bless you. Thank you for sharing your story with us this morning. It is a story. Sadly, so many women will encounter the challenges, but thank God for people like you to help them through it from your own personal experience. And I want you back over and over again, Deb. Please, okay? Come back again and happy Easter to you.
Thank you so very much, and happy Easter to you too, Ken.
You bet. Thanks so much.